All right, sound check one presenter for June 17th, ENCS. Sound check one presenter. And sound check one clerk, June 17th, ENCS. Sound check clerk.
Just a quick question,
Oh.
Elsie Bates.
Yep.
So let me know when we're
Okay,
live.
we are in progress.
Good afternoon, committee colleagues, guests, staff, and the viewing public. We are just waiting for quorum before we can call this meeting to order. Good afternoon, Councillor Marula. Just want to make sure that we can hear you. You can see you just fine. So far, can't hear you. We just want to make sure all the systems are working. eScribe has been a bit of a
Testing,
challenge.
testing. Can you hear me?
Perfect. Thank you so much. Yes, we
All right,
can.
excellent. Thank you. Sorry I'm late.
Excellent. No worries. Good afternoon, committee members, colleagues, guests, staff, and the viewing public. I'd like to call this meeting of the Emergency Community Services Committee meeting for June 17th to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also audibly or visually be recording this meeting, and all electronic devices are to be switched to a non-audible function during committee meetings. Members are reminded that we do have a 5-minute time limit, which will be adhered to during this meeting. You can always submit another request to speak if you need more time to ask questions or make comments. Please note that quorum is present and Councillor Clark is away on city business and Councillor Whitehead is absent on a leave of absence. Moving along to approval of the agenda, Clerk Bates, are there any changes to the agenda?
No, Madam Chair, there are no changes to the agenda.
Excellent. May I please have it moved by Councillor Jackson, seconded by Councillor Marula to approve the agenda. Please indicate electronically if you can, and if eScribe is acting up as it is for me, indicate visibly. And Councillor Pauls has eScribe correct? Up and
My apologies, I answered without my microphone on. Councillor Pauls does not. Councillor Pauls, are you able to turn on your camera and give us a thumbs up or down?
See me. I turn on my camera.
Oh, I can't see you. Do you want to vote
Yes,
audibly?
I'm
We could.
okay.
You're voting yes?
Yeah, I'm good. Yes.
Okay.
Thank you. So the agenda votes are
Chair Nan, Elsie Bates, I saw no electronic vote up, so I'll give you a thumbs up for now.
Excellent. Thank you, Councillor. I did have you marked as absent for some reason. eScribe seems to be acting up for me as well, but the vote is closed and it is unanimous.
You know, Elsie Bates, at a time when you really needed every single one of them, you had me absent. That's okay. We'll talk later.
Very well.
moving on to item number 3, declarations of interest. Are there any interest to declare at this time? Seeing none, we'll move along to approval of the minutes of the previous agenda. Item number 4, may I please have a mover by Councillor Paul, seconded by Councillor Jackson to approve the minutes of June 3rd, 2021 meeting. Any discussion on the minutes? Seeing none, we'll move to vote. And I see Councillor Paul's thumbs up. Myself thumbs up, and Councillor Marula and Jackson will indicate electronically.
The vote is now closed and it is unanimous. Carried.
Thank you. Moving on to consent items. Item number 7, the integrated 7.1 is integrated housing system report CS 13033A. Any discussion on this item? Seeing no discussion, may I please have a mover in Councillor Pauls and seconded by Councillor Marula to approve the recommendations of this report. Thumbs up with Councillor Pauls. Also in favor.
The vote is closed and carries unanimously.
Thank you. Moving to point 2, the Seniors Advisory Committee meeting minutes of May 7th, 2021. Any discussion on item 7.1 or 7.2? See, is that thumbs up, Councillor Jackson, to move it or to move it? Okay, there we go. Moved by Councillor Jackson, seconded by myself to receive the Seniors Advisory Committee minutes. Thumbs up by Councillor Pauls, Councillor Jackson, and myself. Councillor Marula, please indicate electronically.
I'm sorry, I keep speaking, Madam Chair, without my microphone on. That vote was closed and carried unanimously.
Thank you. Moving on to staff presentations, item 8.1. Hamilton's Community Safety and Wellbeing Plan Report, HSC 19032B. I'd like to call on General Manager Paul Johnson to start the presentation. I see your camera is on and your microphone is on, and if you can share your screen when you're ready. I'll also introduce that we have additional presenters on this item. Jen Hall, who is the Senior Project Manager, Business and Support Services. Pat Mandy, Board Member of the Hamilton Police Services Board of Directors. Kim Cervella, Chief Executive Officer of Banyan Community Services. Kojo Damti, Executive Director of Hamilton Center for Civic Inclusion. And Grace Mader, the Director of Human Services Integration here in the city. The floor is yours, General Manager. Thank you.
Well, thank you very much. And through the chair, I will do the least amount of heavy lifting through this. And that is appropriate because it has been many others that have done the work on this. But I just want to say this, as you know, and as all of council knows, municipalities are required to complete a community safety and well-being plan. And the deadline is fast approaching us of July 1st. And we set out on this work pre the pandemic. We continued this work through the pandemic. And I just want to say a huge word of thanks to two of the staff folks that you've already mentioned will be part of the presentation, Jen Hall and Grace Mader, both of whom have shepherded us through this period of time. But more importantly, I want to say thank you to all of the community partners who have helped inform this plan. And today we'll be sharing much of the work of this plan and what's next with this plan with you today. Their commitment to this, again, through a pandemic, when they have lots of work to do as well, is to be commended. The plan is only going to be successful if we work together on it. And so I just want to say my word of thanks to both our staff who worked through this and our community partners who supported that. And with that, I'll turn things over to Jen Holhall, who is a senior project manager within our department. She works out of my office and does just a host of things. But one of the things she is incredibly good at is steering us through plan development like this. And so I know that the whole group has benefited from her expertise along the way. She's going to kick things off for us and then turn things over to 3 of our community partners who will help us with the presentation today. So thanks very much for the opportunity to bring this forward. We're excited by it and the next steps that this plan represents.
Thank you.
Thanks, Paul, and good afternoon, Chair and committee members. My name's Jen Hohal. I'm a Senior Project Manager in Healthy and Safe Communities. And a piece of my work over the last year or so has been supporting the advisory committee in the development of Hamilton's Community Safety and Wellbeing Plan. And as Paul mentioned, the Community Safety and Wellbeing Plans are mandated through the Ministry of the Attorney General through the Safer Ontario Act, and does require that all municipalities develop these plans and have them posted by July 1st of this year. This legislation also directs who must act as a member of the advisory committee in developing the plan. So Hamilton's Community Safety and Wellbeing Plan that you have before you today is the city's response to this provincial requirement. And again, I do want to echo Paul's thanks to the community members. We're very thankful to have the advisory committee here today. 3 individuals who will be presenting to you a little bit more about the information in the plan and the work that they've done. So presenting today will be Kim Chivarella, the Chief Executive Officer of Banyan Community Services. We have Kojo Damptey, the Executive Director of the Hamilton Center for Civic Inclusion. And we have Pat Mandy, who's a member of our Hamilton Police Services Board. Director Grace Mader will also close the presentation with a few comments on the recommendations with the accompanying report. And again, I do want to take the time, as Paul did, to thank the advisory committee and those who participated from the community in this work. It was a requirement from the province for collaboration, which came with no additional resources and only a very small deferral of timelines due to COVID-19. So during this whole process, we really had to rely on the expertise and the willingness of our partners to participate in virtual advisory committee members, meetings, and virtual engagement sessions as well, among their other competing and urgent priorities in their own organizations to respond to COVID-19. Just to give you a little bit of insight, many of the municipalities are using the community safety and well-being plans to start conversations in their communities and bring partners together. And we're very lucky in Hamilton that work within each of the priority areas that you'll see. These are big, complex issues in our community, and this work is not new for our partners. They've been coming together and really tackling a lot of these challenges and issues for many years in the community. So we really do thank them for their commitment this time through the work of the Community Safety and Wellbeing Plan. And so today we're going to start with Kim. I'll turn the presentation over to her to dig into some of the next slides.
Thank you, Jen. And I know I'm supposed to introduce myself, but I think I've been introduced twice. Yes, I am Kim Chivarella, and I am the Chief Executive Officer for Banyan Community Services. It's actually a youth justice and children's mental health organization that serves both the Hamilton and the Agra area. And I just want to say thank you very much for bringing us together, Jen and Grace. And just to let the committee know that I've been part of the Hamilton Safety and Wellbeing Plan Steering Committee since its inception back in January 2020, which with the pandemic in the middle of it, seems like an absolute lifetime ago. So thank you again for giving this opportunity. Today, just a little bit about what we're presenting. We're going to tell you a little bit about who we are, what we did, what the Hamilton's Community Safety and Wellbeing Plan actually has within it, and obviously a little bit about next steps and moving forward. Next, please, Jen. So who we are. As you can see from the slide, a great cross-representational group from organizations throughout the Hamilton area. The advisory committee was formed to support the development of the Community Safety and Wellbeing Plan. And for the committee, please know that the advisory committee meets both legislative requirements and also brings together, as I just mentioned, various sectors' perspectives. And we have to provide strategic advice and direction to the city on the development of this very important plan. Next, Jen. So the advisory committee was tasked with supporting the development of the plan, as I mentioned before, for the Hamilton area. A big part of this and the aim of the community and safety well-being plan was to ensure that all residents felt safe, they have a sense of belonging and can meet the needs of education, healthcare, food, housing, income, and social and cultural expression. So very tall order. Jen did mention that a lot of this work is not new for the Hamilton area, and a lot of the community members have got lots of good, I would say, irons in the fire. But I believe, as being part of the advisory committee and part of the province's directive to bring this safety plan to light, we have a really great opportunity to bring some of the good work that's already being done and look at it differently in a very coordinated way. Just before I pass it off to my colleague Kojo, I want to reiterate to this committee that though engagement was part of the process, thanks to Jen and to Grace, I think it was always part of the feedback. There wasn't a meeting we didn't have as an advisory committee that Jen or Grace hadn't reached out to different sectors based on the advice they had gotten through the community members when they put it up live on the city website. She joined me with another planning group in the children's sector area. All through this, the plan, though part of it was engagement, most of it was done hearing from other people in the community, putting it and making this document quite live and real. And I think we're all very excited to see what the next few years bring in relation to how we can really work together to make all of these objectives come to light. So with that, if I could turn it over to my colleague Kojo to give you a little bit more insight as to what the plan actually has. Thank you.
Thank you, Kim. So my name is Kojo Damte. I'm the Executive Director at the Hamilton Center for Civic Inclusion. So what did we do? Well, as Kim and General Manager Paul Johnson said, this work started in the basement of the Lister block in January of 2020. And there were a number of organizations, institutions that came together, and we started having conversations about safety, the work that each organization is doing, and what are the priorities. And there were a long list of priorities. I think it was Grace Mader and Jen and some of the policy analysts at the department that guided us or facilitated a discussion of how we get through all of these priorities. And we also had conversations about how all these priorities are also connected. So we started that discussion. We came up with a number of priorities. It was very difficult. We had to combine some of the priorities because we know they are all connected, and the pandemic hit, and so we had to take a break. Uh, but in taking a break, what we realized was that um, even though we had come up with draft priorities, we needed the community to be involved and to have some input. So that work was done, and it was done in a way that allowed for service providers and community organizations to go and talk to their respective uh, connections about safety, as well as the city have its own space to reach out to residents to talk about what is safety, what they deem to be well-being, and how we can do this work. So all in all, there were virtual consultations that were done, 95 participants, service providers also had their own engagement sessions. There were 26 participants. And then there was a dashboard on the Engage Hamilton where we had about 275 folks give us useful information around safety and well-being. And so that allowed us to get a cross section of ideas around what is safety, what is well-being, and what are and what some of the priorities are. And so I will hand it over to colleague Pat Mandy, who will talk about some of the things we learned from these community engagement sessions, the priorities, and some of the things that residents even suggested to us that we now have included in the plan. So I'll hand it over to Pat.
Thank you. As you've heard several times, my name is Pat Mandy. I'm a member of the Police Services Board. They give me a microphone and I might say anything. And I just thought, well, I had the opportunity as a proud member of the Mississaugas of the Credit First Nation, want to remind everybody that this is National Indigenous Peoples Month. So get to know somebody and learn a little more about our history. Anyway, what we learned in Hamilton, and it was by community engagement, is some very important issues that we have to keep in mind as we go forward. One is that safety is not the same for everybody. When one person feels safe, another may not. I think a good example of that is with police. Some people feel very safe when there are police at an event. Others feel unsafe and sometimes threatened. So it's important when we're making decisions that we do continue to get input from the community. One of the things that we heard from almost every sector and every group was, yes, the priorities are important, but the way that we approach them, the processes that we use are just as important, if not more important. That it was important that we go forward looking through the lens of equity, diversity, and inclusion, that we continue with the community engagement, that we have to be able to measure what we're doing and what the outcomes are. We have to have sustainable funding. We can't start things to later falter. And the importance, and this is Kim talked about already, is the system collaboration. And we've seen that as throughout the consultations, and we know that will continue. So as we go forward, I found that this part was actually one of the most important parts and most exciting, that this is what we heard and will be foundations as we move forward across all of our planning. So I think it's back to Kojo.
So thank you, Pat. So what are the priorities? So we managed to come up with 6 priorities. Residents had a say on the 6 priorities. So they are hate incidents, violence, mental health and stigma, substance abuse, housing and homelessness, and access to income. This work, I think, as Pat and Kim has mentioned, allows for municipalities to have a broader view of how to address safety. And the provincial framework that has been outlined here actually allows us to think about safety in a holistic point of view. So they have these 4 levels, the first level being social development, second prevention, third risk intervention, and the last incident response. So the way that we kind of saw it is that if you're going to address all of these 6 priorities, the first 3 have to do with preventative measures. And then when the preventative measures don't succeed for whatever reason, then now we are left with an incident response. So I think this framework is something that it's important for the city. It's something that all 444 municipalities will have to adopt in some form or fashion, and it would really give us a way to address some of the priorities um, that the province has set out here, and so we use that in our work to come up with some of the opportunities that may lie ahead and some of the actionable items that we need to work on. So I think the key message from this slide is these are the priorities, and to tackle these priorities, we have to start thinking about, 3/4 of preventative measures and 1/4 of incident response, and figure out how we get to creating a Hamilton that is safe for everyone. And I believe I hand it over to Pat again.
Oh. Okay, thank you. So you'll see in this slide a number of projects that are already underway. Within the plan, each of the local priorities include community highlights, which will showcase the work that's already in progress in Hamilton, and that the members of the advisory committee are leading or participating in. So there's a lot more going on than what you see here, and well worth a close read in the report to see the breadth of services. I'm not going to read the slide to you, but just you'll see here a variety. Some are in prevention, some are in actually assisting homelessness, and educating community, I think, is important, because that will also spread the word and help across the broader community in implementing the practices that are here. So I think that we're back to Kim.
No, it's back to me.
Oh, back to you. Sorry,
It's
Joe.
all good. It's
Didn't
all
have
good.
didn't
It's
have
all
my-
good.
Okay.
Yeah. So those are as Pat mentioned, those are some of the things that are already in motion. So the next question is, what are the opportunities for action, and what can be done? So on this slide, we have hate incidents. Hate has been an issue here in Hamilton for a number of years. We've seen the impacts of hate, whether it's in London, Quebec, Edmonton, what have you, and so when we use the provincial framework of uh, community safety and well-being, that means that we have to invest and we have to talk about the preventative measures, social prevention. So what does that mean? Exploring alternative locations and formats to report hate crimes and hate incidents. We saw what happened in Stony Creek and Waterloo in the past year and a half. So how do we ensure that residents that experience hate um, have ways to report these hate crimes? And when we talk about hate, there's a broad spectrum of hate. So here, as Pat mentioned, we have to address, the call 57 from the Truth and Reconciliation Commission of Canada to provide education to public servants on the history of Indigenous peoples, including the history and legacy of residential schools, right? And these things are the proactive preventative things that we can do to ensure that we don't have the incidents that we see, because once you get to the incident, we've already failed, whether it's the person that is perpetrating the act or the person that is receiving or going to be impacted by these acts. And so I think it's important for us to think about uh, those preventative buckets, the three buckets that are listed in the provincial framework, The city has done a good job of coming up with, I believe, over 40 recommendations around the urban indigenous strategy. So how do we put that into motion? The city has also invested some money into the Hamilton Anti-Racism Resource Center. I believe they're looking for, they're going to be hiring a new executive director. And where would that center sit again within those buckets of prevention? So there's opportunities for action, and it's important that this action will take investments, financial investments, um, human resources investments. And so it's important that those investments and those funding opportunities are embedded into this plan. And so, having said that, I think the best thing I can do is I can hand it over to Director Grace, who will do the how do we get these opportunities into action.
Thanks so much, Kojo. So you can see that from our partners that it's going to take all of us to working together in order to tackle some of these very large projects before us in order to really make a dent. And as Kojo mentioned, it's going to take the existing investment that is already on the table, but it's also going to take more than that as well. We've reached out to our other partners in the community when it comes to those that are in the opportunity to make investments. The United Way, the Hamilton Community Foundations, our partners around the anchor institution tables, to have to look to all of them as to how we're going to leverage what we already do and where can we look for those new opportunities for investments as well. We also know that it's going to take somebody that wakes up each and every day that to look after this and really bring this plan to life, because a plan is only as good as what's written on the pages, but it has to come to life some way. And so in the report that we presented to you today, we are requesting the 1 FTE under us as a senior project manager to help us move this work forward. Then we also, when we came and presented to committee and council earlier, we heard loud and clear about how important engagement is and hearing from our community partners. And as Kojo and Kim and Pat have all mentioned this, is that's just the start of this. We know that we want to do more of that. We want to hear directly from some of those groups that are well underway of accomplishing some of these efforts, and how do we leverage and build on what they're already doing. So we will be looking for it to come to life as we move along. We also, as mentioned about investment, we also know that it's going to need all 3 levels of government working together to bring this to life as well. We have federal and provincial investment in our housing and homelessness system, our access to income. How do we ensure that those investments are prioritized to what this plan is going to be identifying as its outcomes? We also know that this is just the start of this journey. We are just at the beginning of it. So we're really excited about the kind of momentum that we've already been able to galvanize around this, and we want it to continue. And we're really looking forward to the support from committee and council, submitting this plan to the province by the end of the month as required, and then getting on to the really important work that we've got ahead of us. So with that, I will leave it open for any comments, questions from council members, and we really appreciate the opportunity to do this presentation today. And I realize now that I didn't introduce myself. Grace Maynor, I'm a director with Healthy and Safe Communities. Thanks very much.
Thank you, Director, and thank you to all of the presenters on a very thorough presentation of, turning the limitations of the pandemic into something that we can work with. Community members, open for questions or comments on the presentation. Anyone? Councillor Jackson, the floor is yours.
Thank you, Chair Nan, and very informative. Good to see the status and the progress of the Hamilton Community Safety and Wellbeing Plan. And thank you to, as you said, to Jennifer and Kim and Kojo and Pat especially for their presentation. So if I could ask for you to Director Mader, Grace, you are ultimately requesting a new FTE. Is that because this plan, if it's to evolve and become a permanent form of engagement across our community, is bigger than or larger than the resources or the individuals you may have within your division that could shepherd it from this point forward? Through you, Chair Nan, please.
Through the chair to Councillor Jackson, yeah, you're exactly right, Councillor, that we don't have any existing resources that we're able to dedicate to this. And as we said, if we're really going to make a difference and use this plan as a stepping stone, we want to have that dedicated energy towards it to make sure that as we look at the development of an implementation plan for each of those priority areas, that someone has that responsibility on their desk each and every day, and not something that's just on the side of someone's already full workload.
Okay, fair. I appreciate the explanation, and I'll be supportive, Chair Nan, of the recommendation, especially the B part of setting aside those dollars and through future budget deliberations. Just through you, Chair Nan, to Executive Director Kojo Damti of HCCI. Kojo, as we try to be as inclusive as we possibly can, without, if you will, causing paralysis by holding up a plan, do you feel that the engagement has been diverse enough, widespread enough across our community so that as the plan moves forward and is solidified, no ethno-cultural group, no racial group, multilinguistic group could ever say, Councillor Jackson, I didn't even know about the community safety and well-being plan. Through you, Chair Nan, I just wonder if Kojo can give me some feedback because of his direct and permanent involvement on this program.
Thank you.
Please, Kojo.
Through the chair, it's always going to take work. We had different organizations. All those different organizations that were part of this committee did their own reaching out, and then the city also did their own virtual town hall or space to talk to
Okay.
people. It was also on the Engage Hamilton website. There were people that were left out, but I think as Director Gray said, this is going to be a continuous thing, because even with the 6 priorities that we've come up with, in
Yes.
the next 2 years, 3 years, they might have to change, right? So this is a continual process, and that is why by hiring someone that's strictly dedicated to this, that can be a role that they also include in their work, in that they're reaching out to different folks, different communities, different sections of our city, Ward 15, Ward 1, wherever people might be, because it's also a difficult work to do, right? So I think by having this plan, having someone that's dedicated to the plan, we'll be able to ensure that everyone is included in this plan moving forward.
Terrific answer, Mr. Damty. Thank you. And I guess as an analogy, Chair Nan, just to finish with Pat Mandy, myself on the police board, we hired our wonderful community relations coordinator, Jazz Dillon, and we hired that position to ensure those type of community relations did not just, if you will, get spread amongst different police officers, but had somebody that was specifically in charge of community relations on behalf of police services in our community with all the racialized, ethnocultural, multi-religious groups in that. So Director Mader, back to my original question, I see exactly the efficacy and the benefit that the new position will provide. Chair Nan, thank you for allowing me comments and questions. Very excited about where we are as a community. Thank you.
Thank you, Councillor Jackson. Any other colleagues on the committee have any questions or comments related to the presentation? Seeing none, I will then please have a mover, and Councillor Jackson, I'll second it, to receive the presentation. And we will move on to receiving a vote there to receive. So those councillors able to do so, please indicate electronically. Councillor Pauls and myself will have to indicate visually. Thank you. Thumbs up from the two of us.
The vote should be coming up. All right, so thumbs up from Councillor Nan
And Councillor
and
Pauls.
Councillor Pauls. There we are. The vote is closed and it carries unanimously.
Wonderful. And may I please have a mover again in Councillor Jackson and seconded by myself for the report to be on the floor. Any questions on the report, although it was highlighted quite thoroughly in the presentation? At this point, committee members, anything else to discuss? Seeing none, that's before you for a vote then. And again, thumbs up from myself. For Paul's, I just missed you visually. Yep, there we go. It's in favor for Councillor Pauls.
And my apologies, Councillor Nan. Who were the movers and seconders for that, for the
Councillor
report?
Jackson and myself.
Okay, same as for the,
Correct.
all right, the vote has closed and it carries unanimously.
Thank you so much. And again, a big thank you for everyone, everyone's efforts, as well as all of the partners in these different sectors who came together to not only get input, but also identify the priorities and bring this report forward in such a fulsome way. Thank you all. Moving on to 8.2, Hamilton Paramedic Services 2020 Annual Report, Report HSC 21-018. I'd like to call on Michael Sanderson, Chief of the Hamilton Paramedic Services, to give a presentation. Michael, please, your camera is already on, your microphone is on. Go ahead and share your presentation when you're ready. The floor is yours. Thank you.
Thank you very much, Madam Chair. And hopefully the video and the slides are showing properly.
Yep, we can see them.
Perfect. So thank you, Madam Chair, members of committee. I'm very pleased to present the annual report for the Hamilton Paramedic Service on behalf of all of the men and the women of Hamilton Paramedic Service. 2020 is really a year like no other. It's been just over 100 years since the last worldwide pandemic, and we're living through another one. We've gone through a lot of tragedy and sorrow, the impact of COVID on our community and on our staff and on our people. But we've also gone through a year of integration and innovation. It's brought a lot of things forward in the process, and I think that's what I'd like to try to focus on as we move forward on some of those. Before I get into the report, I'd like to thank the city manager, Jeanette Smith, and of course our general manager, Paul Johnson, for their unwavering support and guidance as we've moved our way through the activities. And also other special thanks to our senior project manager, Linda Button. Linda, while we're working through all the operational issues, had to remember that we had to do an annual report, make sure that we have information that we can share with council and share with our community. So thank you to Linda for making sure that we have this done in the great format that she always does. So the first process that we like to look at in terms of our annual report is how much do we do, how well do we do it, and is anyone better off? And I think those are three important questions for us as we go through it. As we move through the slides, and I've already gone through this slide a little bit with council before, we've talked about the impact of COVID on society. We know that during the early time period of the COVID, that March, April, and May time period, our call volumes were below average, our transports to hospital were below average, the responses are below average. Basically the demand for service. We had a significant increase in terms of our time on task and some of the things that we had to do in that activity. But since that time period, our volumes and demand have continued to increase. And of course, it's risen at a bit faster rate than we would have expected, but that's just the process of what we have to do in terms of managing the activities. Putting it into the easier perspective in terms of day-to-day activity, when we look at the number of events per day and the number of responses by paramedics per day or transports to hospital, you can see them there. And I can tell you that on an average day, and averages are a difficult concept because you're often above the average and below the average, in an average day, our responses were down slightly. That's primarily due to the major decreases in March, April, and May of that time period. So we had significant decreases during that period, and that was noted on the previous slide. We are expecting it's going to continue to resume in the activity. But thankfully, in terms of the reduction in the responses, we actually had time to manage some of that activity. Certainly, you'll see in other slides some of the challenges at the hospital level. And I'll just come to those right now in terms of our Code Zero events and the level of activity, because those are always something that we're asked about. I was asked about it during the budget process. with the reductions in the hospital volumes, we saw a huge improvement in the hospital offload delays. It was significant. Our lost unit hours were reduced by about 30%. That's an improvement in the number of patients offloaded in the provincial 30-minute target time frame. And our code zero events decreased significantly. We went from 80 code zero events in 2019 down to 27 code zero events in 2020. The 20,997 hours is down from around 30,500 hours. So those changes were significant for us in terms of the improvement, but we also had a significant increase in the time on task, the time it takes for paramedics to actually complete a call with the additional precautions that they have to take on a call, and of course the additional cleaning on all the post-call activity. So those balanced out nicely in the process, but it actually improved the level of service that we're able to provide to the public, and certainly it took some pressure off in terms of the level of activity and the stress on both our staff and on the hospital staff in terms of the zero events. Through the year, you'll see that we've shifted over and talking about our community paramedicine activity as mobile integrated health. And we've done that in terms of a change to better reflect the nature and the breadth of our many community paramedic initiatives. We're doing many different initiatives now on the community paramedicine side, funded by the province in various aspects and activities. Our remote patient monitoring and the follow-up on remote patient monitoring has expanded significantly with funding from Ontario Health. And when we look at the 115 RPM clients in terms of the RPM patients, that's remote patient monitoring, the success there is that we've had over 3,473 alerts put through the automated intelligence systems from those clients that were registered in the RPM program during the year. And out of those 3,473 alerts, there was only 4 patients we had to transport to hospital. The other interventions were a follow-up at the house by community paramedics, going to visit at the house, follow up by phone call, those levels of activity. And that's pretty significant for us in terms of an actual return on investment. So we're really pleased with that in terms of the activity. And of course, the 1,840 flu shots, the 621 patients in the at-home program where we're doing other types of activities, the clinic visits and the phone calls that we end up moving forward on. So mobile integrated health continues to be alive and well. I can tell you that Hamilton was one of the early leaders in developing community paramedicine and moving forward on the mobile integrated health concepts, and always the support of council. That work is paying off in dividends for both the province and for the city, I believe. You'll also see, and I want to draw your attention to the picture of the small van up top there. You'll see we have it labeled as mobile integrated health. And one of the things that we found as we move through the year, our community paramedics are not responding to emergency calls. They're responding on a non-emergency and a planned basis. So we don't need to have an emergency response vehicle for that. As we were transitioning out with the community paramedicine long-term care funding, and the province was actually buying some additional vehicles for us for mobile integrated health activities, we opted not to go with emergency response vehicles, but instead a much less costly and more effective and efficient process for our community paramedicine program and the activity. So it really has been about trying to figure out better ways of doing things and at a better cost in the activity. I would like to speak about our Social Navigator program as well. The Social Navigator program, we had 77 very high complexity, high intensity clients in that program. It's a very complex case management process. We work very closely with the Hamilton Police. It is their program and we're supporting in that program. We also had 512 other individuals on top of that we ended up interacting with in short-term situations and trying to assist them, referrals to support services such as housing and shelter, support for the encampment program over the summertime and through the fall. And of course, our work on palliative care and our work on moving patients to alternative destinations such as the men's shelter and women's shelter, those have now been moved forward for frontline implementation. All activities that we've been championing and trying to move forward over the last few years, and we've been able to bring them through to fruition in 2020. In terms of COVID response, this is showing the number through to the end of 2020, and I can tell you our numbers through to the end of May and going right into June are much higher than that in terms of the activity. But at the end of 2020, we had 12 paramedics trained for COVID-19 testing. That's doing the nasopharyngeal swabs and the range of activity to end up doing an assessment as to whether a patient has COVID or not, and integration with public health and with St. Joseph's Hospital. 9,504 swabs taken by our paramedics for diagnostic testing. We assisted in 2 large evacuations from long-term care homes, which of course were difficult in terms of the impact on the clients that are in those long-term care homes, but also on our community in terms of the effect and seeing what was happening in that process. Our paramedics looked after and assessed by the end of the year 9,138 suspected COVID patients. Large number. I can tell you that by the end of yesterday, it was about 14,800. So we continue to increase in terms of the activity for that, but we're doing it very safely and very effectively. And we've certainly learned an awful lot about managing that as we go through the time period. We started assisting, and it's hard to remember at this point in time that it's just a short while ago we started having immunization shots for the community, for healthcare workers, and for those that are in need of doing that. And at the end of December, we'd only had 6 different assistances from paramedic crews at the Hamilton Health Sciences vaccine clinics. That was really the start of the programs and the start of immunization. We've now had 496 clinics assisted by our paramedics in terms of looking after the clinics. And of course, we're doing homebound immunization as well. So the major shifts that we've had in the process are about COVID testing, COVID immunization, vaccine support. None of the things that we would have contemplated back in 2019 as we're developing the 2020 budget process, but that goal has been to augment and support broader community activities and to leverage the expertise of paramedics to make sure that we're utilizing them to the fullest extent possible. And I have to say, with the assistance of the union activities and the leadership that we have with Mario Posturero and OPSU, we've been able to transition that relatively well in the activities and come to agreements on how those things are managed. The other thing that I would comment on is most of these activities have been funded through various grant funding from the Ministry of Health and the various processes, including the LIN and other community areas. One of the things that we always report on, because we're required to report on them in a public sense, is our response time performance. And the format for response time performance reporting is mandated by the ministry. And of course, they look at it by the CTAS category. And CTAS, for those that aren't aware, is a Canadian Triage and Acuity Score. And that's the score that's assigned to a patient, with 1 being the most critical patient and 5 being the least critical patient, following paramedic assessment at the scene. So the reporting that we do is not about how we responded, whether it's a lights and siren response. The reporting is about what we found when we arrived at the scene and which patients are in that category. So for vital signs absent patients, you can see that 88% of the time we achieved the target of having a defibrillator to the patient within 6 minutes. And of course, the standard that the ministry applies on that is 75% of the time. So we've exceeded that standard. That's in some large extent due to our semi-automatic defibrillator placement within the community and the number of AEDs that we have placed across the community. As we look at the activities, we continue to exceed our performance on the areas. The categories for emergent, urgent, less urgent, and non-urgent are identified by council, so that the mandate in terms of the target times is something that council set several years ago. I can tell you that the times that we achieved in 2020, despite the challenges that we had, are substantially the same, with some slight improvements, 1 and 2 percentage points to what they were in 2019, and very similar to what they were in the year before that. So we continued, despite the pandemic, to have a good level of performance on the ministry reported things. These times are available on the government website. They're publicly posted by the government on an annual basis. I know that an issue that's near and dear to council's heart and near to mine is how we operated financially and what our challenges and our pressures were. I can tell you that our employer-related costs are the significant driver for all of our activities and the costs. We're 83% employer-related costs in the last year. The costs are driven by that. And our costs last year were significantly affected by a couple special items in terms of the activity, and that would include COVID self-isolation for our paramedics and the cost for staffing. I can tell you that we've had 322 of our paramedics placed into self-isolation for various time periods since the start of the pandemic. It's also affected in terms of the cost per response in the budget through the Ministry of Health and the LIN funding for the activities of the community support. For example, the expansion of community paramedicine, remote patient monitoring, those costs are included in there in terms of our overall cost, but those were Ministry 100% funding. In terms of our quality assurance, we look at the number of complaints, we look at the number of compliments we receive, and of course we look at the number of collisions. Those are the basic 3 metric areas, and everything's grouped under that in the activity. We have lots of feedback from individuals. We receive that on an ongoing basis, but we continue to review those and to make sure that our paramedics are aware of the issues and the challenges. I would flag for the members of committee that of the 66 collisions, that sounds like a big number in terms of collisions, and it is. We're not happy with it in terms of the process, but almost all of those are very minor in nature. We do a documentation and a collision report on every incident, whether it's a scratch on the vehicle, a scratch on the bumper, or whether the mirror got broken off, or whether we had a more major incident in terms of the activity. The vast majority of incidents are backing up and clearance accidents. That's the mirrors, overhead clearance, side clearance, and some of those accidents are actually where our vehicle was stopped and somebody ran into the ambulance. Uh, None of the accidents for the last year resulted in any injury to either the public or to our paramedics, and none were significant damage in terms of the level of activity. It's actually good to see in the process that our compliments coming in exceed the number of complaints. So that's good to see that change in terms of the ratio in the process. We also continue to have solicitation of feedback within our programs. And the 3 programs that we solicited feedback from our clients on over the year were the at-home clients, those looked after by our community paramedics in that group of activity. And the rating for them, 94% of them rated the service as excellent. We have a survey that we manage in terms of that activity. The 96% client satisfaction was the FRED program, which is our flu response and emergency department diversion for long-term care. And that program only ran for about 3 months, and we had to kind of pivot that program into COVID response at the end of March last year. But the response from the FRED program was 96% client satisfaction. We managed to divert many patients away from the emergency department, and that worked pretty effectively in the process. 98% of the clients at the flu clinic wanted to return next year. So good response on that. I know Councillor Jackson, you ended up supporting us and trying to help us to make sure we get that flu clinic program in place. And I have to say that was a great success in the activity. And we also learned an awful lot from that as well as we expanded, and we're planning to repeat that as we come up into the next fiscal year as well. Great feedback and comments from the clients to help us to further improve the program. Other feedback comes to us in the form of letters, phone calls, a variety of social media posts, including Twitter. And of course, now we're on Instagram in the process. There's a lot of different things to pay attention to. But great comments coming back in terms of the activity. There's some small samples on here on the slides of things that were put forward by the public in terms of activity. Thank you for the amazing, kind, and compassionate care. Long overdue. Wanted to thank the paramedic, especially Jeff, for the great care when individual broke both arms last July playing in the park, coming to care for my elderly neighbor, geared up, COVID and gowns, scary looking masks. Those are all great feedbacks, and we try to pay attention to that in terms of the activity. I can tell you that our Twitter account for Hamilton Paramedic Service is more than 14,000 followers now. We put out 220 self-initiated tweets this year, plus I don't know how many retweets in terms of our other activity for trying to educate the public on key issues that help us to manage performance. So when we come to the question, is anybody better off? What difference does it make? Well, it does make a difference. I can tell you that there's 134 STEMI responses that improved. A STEMI response is what we refer to as an ST elevation myocardial infarction. That's a type of a heart attack that benefits most acutely from intervention at the catheterization lab at the Hamilton General Hospital. So those are patients that were taken in very acute straits directly to the cath lab, getting better intervention, better care. And I can also tell you that 93% of the time when our paramedics arrive on scene with a chest pain patient, for these identified individuals, Core Health is reporting provincially, we had the ECG done and the interpretation done less than 10 minutes after arrival on scene, contact with the patient. So that's a good outcome. We're meeting the standards on that. The provincial standard is 90%. We're exceeding it. I can tell you that there's 405 patients that benefited from paramedics responding where they had a return of spontaneous circulation. That is, a patient was in cardiac arrest, their heart had stopped. We had what we term a ROSC, the return of spontaneous circulation, and transport to the hospital. Obviously, not all of those patients survive. Many of these are very complex. Sometimes a ROSC determination is a short-term thing, but it's an indication of the effect that our paramedics can have on that. And of course, very much in terms of the intervention, 951 patients under our stroke protocol going to the Hamilton General Hospital for stroke intervention, and about 565 suspected opioid overdoses. And I would preempt the question that I'm sure is on many people's minds. How does that compare to 2019? 2019, in our report, we identified 596 opioid overdose patients assisted. So it's actually down a little bit. It continues to be a challenge, and I can tell you that we continue to hear all of the activities. We continue to work with public health in terms of reporting it. And we are now at the point where our social navigator program is doing naloxone release and distribution as well, so helping to intervene on those activities. In terms of the MIH programs, the home visits, 31% reduction in 911 calls for the clients that are in the home visit program. That's an important intervention. It takes some pressure off of the emergency department. So we're happy in terms of doing that, but it also takes some pressure off of us in terms of call volume and responses. At the flu clinic, 50% of the clients have indicated they would not have been able to get the shot without that clinic. That's a significant intervention, and I think that speaks to what Councillor Jackson was asking for in terms of the 9 facilities that we're doing our at-clinic programs that was in the city. I would draw your attention in that picture to our general manager, Paul Johnson, who is actually getting his immunization. That picture is used with this authorization for public release. And one of our paramedics, Marilyn Petrosky, who's actually given the immunization, she gave me my shot this year, and it was probably the most painless, absolutely painless flu immunization shot I've ever had. And I've had many of them over the years. I'm going to be sad to see paramedic Petrosky end up leaving us. She's finished her 32nd year as a paramedic working and serving the citizens in Hamilton. And today is her last day as she retires from paramedicine. So great for her in terms of the process. I just wanted to recognize her. We have her picture in here in terms of the activity as well. Our remote patient monitoring I've already talked about. And in the social navigator program, I think the success in there is that 55% decrease for the clients that are in that high intensity part for negative police interaction. So that negative police interaction also has a negative or a reduction in paramedic responses and activities as well. Other ones in terms of is anyone better off, and these were 2 key ones that were advertised fairly heavily during the year. Paramedics looking after patients on the left with a resident who had a heart attack. The paramedics swift response to resuscitate him, saved his life today as well. That's a picture of the individual that the paramedics resuscitated. He asked and his family asked to meet with the paramedics. We did that meet up in the process. And the family is so kind in terms of recognizing the activity and the life-saving skills of our paramedics. And on the right is a 3-week-old baby in medical distress, the paramedic skillful care. So it's an example, and we can give you many examples of that level of activity where the families are asking to meet our paramedics and to thank them for the work that's being done. So your paramedics are doing a great job in the city for that. Other things in terms of being better off, it's about the volunteer activities. I can tell you that we had over 10,000 pounds of food and $5,000 raised for the Neighbor to Neighbor food program. I would give some significant thanks to the Global Medic program and my friend Rahul Singh, who ended up facilitating large amounts of food to come from the GTA that they collected from various donors and reallocating that back into the Hamilton area. So we actually had a convoy of 3 vehicles going into Toronto and picking up food and bringing it back in the activity. And of course, our City Kids program, we thought that City Kids was going to end up not being able to run for the toy program and the Christmas toy drive in December, because as you'll remember, we're under many limitations. You couldn't have public gatherings. The level of people going out into stores was very challenging. We transitioned it and pivoted it with the leadership of the people that were running that program over to more of a financial area. And they raised $11,720 for City Kids. And City Kids, of course, was able to purchase toys for the children that needed that in the community. And I would be remiss if I didn't mention our Hamilton Paramedic Community Garden at Station 32 on Lime Ridge. It continues to be very active. Lots of our paramedics continuing to support that activity, and the food from there goes directly to the Neighbor to Neighbor food program as well. When we talk about other improvements, the technological advancements and the innovations, we've been able to transition over and put virtual access to St. Joe's, the emergency department physicians. That's primarily coming from our community paramedics and the home visit programs right now, as well as those that are in the remote patient monitoring. We've expanded the remote patient monitoring, and I've mentioned that before. We trialed an automated chest compression device. And that automated chest compression device was to try to remove some of the activity in terms of a moving ambulance and trying to do CPR on the patient in the back of the moving ambulance with the aerosol generating activities that we end up having to suffer through with COVID. So it's a way of helping to protect our patients, a way of providing better CPR. And of course, in the 2020 budget process, Council approved the actual acquisition of those devices for across our ambulances. And we're in the process of trying to bring that one forward now through the procurement process. So the demand to innovate things is continuing to be there. We ended up getting new recruits during the year. I think we brought in 37 new recruits in 2020. We had to transition over totally to virtual training. So we're doing training online, we're doing training in large groups, and the development of exams and other activity to make sure our paramedics are capable and competent continue to be a challenge. But I have to tell you, our professional development team rose to that challenge, and they're now pretty much experts in terms of delivering distance education. So pretty impressive to watch them do that level of work. We established our infectious disease paramedic team, and that's a reactivation using the PAPRs, the positive air pressure respirators. So we had that available for interfacility transfers during the early days of the pandemic. We figured out other ways of doing that now, but it was a good innovation in terms of the activity. We developed programs to manage our PPE, the protective equipment inventory, enable the use of isolation gowns for city staff, developed enhanced cleaning, disinfecting programs. All of that level of activity it was really important in terms of how we manage COVID, how we learn from the COVID activities, and how we end up doing better in terms of our provision of service, the protection of our paramedics, and the protection of the public. And I would identify, when we look at that 84,000 responses that we did last year in terms of the activity, one of the questions comes, what does that do for our paramedics in the activity? And how does that affect them? I can tell you that out of the 22 paramedic staff that we had that developed COVID during the last year, and that's 22 up until now, 7 of them were potentially at work. Out of 84,000 responses and the large number of suspect COVID patients that we had, the PPE that we put into place, the procedures we put into place, and the support from the city and the screening activities were very effective in trying to minimize that impact and to keep our paramedics safe in the activity. Still challenging in terms of what happened with paramedics getting COVID, just as it is for any healthcare workforce or for any other employee or any other citizen. But we're right at the front of it. We're looking after them in a very unprotected environment, using the PPE and making sure that we have all the right things done for paramedics. So great compliance and great effect on that. Our plans for 2021 are relatively straightforward. We're continuing in terms of our paramedic palliative care. We finished off all of our training on palliative care. We've implemented it. It's now being approved by the ministry as one of the alternative models of care, and I've reported back on that before. We're supporting people in terms of the long-term care placement. That's our community paramedicine long-term care program that's being funded by the Ministry of Long-Term Care. We're continuing in terms of COVAX training for paramedics, vaccinating priority populations, the homebound vaccinations, our interregional interfacility transfers, and we supported that in terms of activity from a provincial aspect. Increasing our community testing, and we're planning to continue having testing available as we go through the year. And of course, the vaccine aftercare. And I would just flag for council that we're continuing our work. We really got waylaid in terms of our 10-year plan, where we're behind on that, but COVID had a significant interference for us on that. And we do anticipate that coming back to council and through committee by September of this year. So, Madam Chair, members of committee, thank you for providing me the opportunity to talk to you and to the public about the great work being done by our entire team at Hamilton Paramedic Service. Our paramedics, our supervisors, our logistics technicians, our schedulers, our support staff, they all work together as a team. They have different roles, but it's all about the same goal. And I thank all of them for their service. And I would remain available for any questions you may have.
Thank you, Chief, for that thorough overview of the annual activity of our paramedic services and for highlighting all of the benefit your services continue to bring to our residents. Colleagues, any questions on the presentation? Councillor Jackson, go ahead.
Thank you, Chair Nan. And just following on your complimentary remark, Chief Sanderson, through a worldwide pandemic and adversity, what a glorious report of the professional, compassionate, stellar delivery of EMS services in 2020 in our community to our citizens by your 300 some odd employees, management, right down to the, especially the front line that are the paramedics and ambulance care servers in our community. Chief, I'd like to just pick up on a couple of points here. As being on the police board as well, I think I heard last time from our chief that about half of the service had their vaccination. Can you give us some indication as to your employee complement all vaccinated, most of them vaccinated, all double dosed? Any indication you could give us here without going into any privacy issues through you, Chair Nan?
Through you, Madam Chair, we started doing immunizations as healthcare workers early on in the process. We made sure that our paramedics had access to it, and tremendous support from public health in making that available to our paramedics as well. I believe we're about 96% complete on
Wow.
vaccinations.
Wow.
Every paramedic that wanted to have immunization has had it made available to them. The majority are either have their second vaccination now or in the waiting game of being able to access that second vaccination. So very pleased in terms of how we're able to access into it, and great support. I have to say Hamilton Health Sciences and Public Health really helped us tremendously in that.
Wow. Well, commendable to the workforce, 96%. That's stunning and sensational. I doubt very few departments or workforces could share that kind of accomplishment with the vaccinations, although most probably wish they could. A couple of more questions, Chair Nan. I want to explore the palliative care. Seems to be, Chief, a new area, fairly new that you're entering into from the mobile standpoint. So help me understand. So a loved one, a family has a loved one on a LHIN's list for a long-term care home, their typical top 5, whatever. The loved one is still at home, some support services, PSWs, whatever coming. Now with this new program and the provincial funding, are you saying now that paramedics as well will be part of the PSWs, the nurses, the Meals on Wheels that attend to that home for that elderly person awaiting the LTC placement? I just want to understand that a little better, Chair Nan, through you.
Through Madam Chair, Councillor, it's a great question. I just clarify the palliative care program is not so much about the people awaiting long-term care. That's a community paramedics long-term care program. The actual process for that, we have 4 paramedics each day in the MIH vehicles that are available. Their assignment and their workload is guided through community care, and it's not about visiting just as a supplementary home care worker or that activity. It's about what work can those paramedics do, the skills that they bring. We're actually able to do point of care testing. The paramedics who are in the program are able to do point of care blood testing. They are going to be able to start intravenous therapy in the process. Our paramedics are being trained in that right now if they're not already trained. Some already are. So those are really expansion of some of the skills. It's bringing their assessment skills, the ability to link back to physicians in terms of the video calls and doing that level of activity, and to make recommendations back to home and community care with respect to what other things can be allocated for those clients that are awaiting long-term care placement.
Thank you for explaining and clarifying. Fair enough. That's great. I just made that note for myself. Thank you, Chief. And lastly, Chair Nan, delighted to hear the enormous popularity, 98% of the flu clinics. Let's get out of this stinking pandemic completely and get back to what we would normally prefer, is that the annual flu vaccination, the influenza. And I'm just thrilled with the overwhelming response. I think we started with a few seniors complexes, a couple up in my ward, and I'm delighted to see the overall client's reaction that they wanted to return overwhelmingly as soon as possible. Thank you, Chair Nan.
Thank you. Any other colleagues, questions or comments on the presentation? Okay, if I could, Councillor Jackson, just going to turn the chair to you.
Floor is yours.
Thank you. Just a couple of comments. So thank you, Chief, for the presentation, and definitely wanted to congratulate the services on the response times being exceeded from 80 to 99% above standard rate. And also add in the chorus around the critical role that paramedic services has played during COVID-19 and the response and the support that has been there. I know that the community, I often have heard back from residents who have received support with a loved one who had suspected COVID symptoms, and the care and attention that they received by those who showed up from our paramedic services to help navigate, which was otherwise a very anxiety-ridden, difficult moment to figure out what to do. So I just wanted to share that because I did get an email from a resident whose family did get COVID and were suffering with the symptoms. And the paramedic services went not only above and beyond from a medical perspective, but that deep care and compassion that our paramedics provide to our residents throughout the community, and echoed also around the community paramedicine services as well. So I just wanted to share those comments publicly, and thank you again for a great report.
Thank you,
Thanks,
Madam Chair.
Councillor Nan. Thank you.
Thank you.
Chair, back
Thank
to
you.
you, Councillor.
Thank My apologies. I muted myself after I spoke. I'll take back the chair. Thank you. We'll move the receipt of the presentation by Councillor Marula and seconded by Councillor Pauls. All those in favor of receiving the presentation, please indicate. Councillor Pauls, if you could come on visibly. Yep. Thumbs up. Thumbs up from. And then Councillor Jackson and Marula electronically, please.
Just waiting for Councillor Marula to vote. Councillor Marula, we're just waiting for you to vote. Councillor Marula may be having some issues. Councillor Marula, are you able to vote?
Or indicate audibly if you're not able to use the eScribe system. Councillor Marula's microphone is muted. We don't see him, and there's nothing coming in on eScribe yet.
No, I am just.
We'll just have to pause here because if we can't get confirmation of his connection, then we're also in a quorum issue.
That's correct. Here he is.
Thank you. Councillor Marula, if you could just confirm your vote in receipt of the presentation from Chief Sanderson on Paramedic Services Annual Report.
He has voted and the vote is closed.
Thank you. Fantastic. So.
And it carries unanimous.
Thank you so much. And so may I please have a mover and seconder to put the report on the floor? Moved by Councillor Jackson, seconded by Councillor Marula. Any discussion on the report? Seeing none, we'll move that on to a vote as well, electronically for those who are able to, and then Councillor Pauls and myself are both thumbs up. LCB vote closed.
The vote has closed, yes, Chair, and it carries unanimously.
Wonderful. Thank you so much. And moving on to item 10, discussion items. 10.1 is emergency operating funding. For Hamilton Arena Partners, report HSC 23 for Ward 6. May I please have a mover and seconder? Moved by Councillor Jackson, seconded by Councillor Pauls to put the report on the floor. And Councillor Jackson, the floor is yours.
Thanks, Chair Nan. And yeah, I'm strongly supportive of this. It's emergency operating funding only because COVID related. So for the public record and for those listening in, through you too, if General Manager Johnson is there or Director Chris Hurstek, just want to ensure this is the wonderful private-public partnership model we've had at the Quad Pad Arena, known as the Mohawk 4 Ice Center, for 17 years. Hamilton Arena Partners has been a model partner with the City of Hamilton, providing additional ice and recreational opportunities at Mohawk Sports Park at the Quad Pad Arena. Over the years, they've made money, the city has made money, and just for the public record, we have run into a logjam because of COVID only, and this is requesting from the Restart program that the province has given us reserve money for COVID-related municipal costs. This report is asking for $500,000 to help offset the lack of revenue from last year because of COVID going into this year. Through you to whoever on management can just confirm that beyond a shadow of a doubt. That's strictly what has happened. Otherwise, Hamilton Arena Partners has been a model partner with the City of Hamilton. Through you, Chair Nan, please.
Go ahead.
Through you, Madam Chair, Chris Hurstek, Director of Recreation. Absolutely correct, Councillor Jackson. This emergency funding is due to the pandemic. Many of the recreation facilities, sports facilities in the City of Hamilton, even our own recreation facilities, have had multiple closures, or participation levels have been limited as well. And that really reduces the ability to generate revenue, especially for the Quad Pad, who really rely on the rentals of their ice to pay for their operating costs. So this would be a maximum upside limit of $500,000 on a required basis, so going out through the whole year of 2021.
And thank you, Director Hurstek. And again, just to be crystal clear, this $500,000 is not going to our private partner. This is to help your department because of the loss of revenue in this partnership and tapping into the Safe Restart COVID reserve funding. So that money is for your department because of a lost revenue. We're not handing this money to the private partner. Through you, Chair Nan, please.
No, through the chair, Councillor, we will be providing the funding to the private operators so that they could pay their bills, which is our own facility, which is the city-owned facility. They'd be paying the utility bills and all of their operating costs on our facility.
Okay, then. So it's money to them, which is the revenue they lost during COVID, that will be coming to us to compensate what we didn't get from them directly in normal times. Let me reword it that way. Through you, Chair Nan.
Through you, Chair. That's correct, Councillor. They would be paying their own operating costs from the funding that we would be providing them. That's correct.
And when we get out of COVID, hopefully sooner than later, do the Hamilton Arena Partners want to carry on with us as they have successfully for 17 years? That's my last question.
Through you, Madam Chair, absolutely. They've been wonderful partners. They've been operating the Mohawk Sports Pad, Quad Pad since the inception, and I believe it was 2005 or 2006, Councillor, which I'm sure you're well aware of because you're a big supporter of that facility.
Thank you, Director Hurstek. At the appropriate time, Chair Nan, I'm happy to stay with moving the report.
Thank you. Councillor Marula.
Thank you, Madam Chair. Yes, I just wanted to congratulate Councillor Jackson on this particular initiative. Back in the day, he handled this entire project with the arena and the partnership, and for that, I think he should be commended. So I just wanted to bring light to that. Thank you, sir.
Thank you. Seeing no other further speakers, we will move to an electronic vote. Councillor Pauls, if you could indicate visibly. And this is on item 10.1, the emergency funding for the Hamilton Arena Partners. Thank you.
Thank you, Councillor Pauls. Councillor Nan, you're a yes? All right, the vote has closed. And eScribe is chugging along. Carries unanimously.
Thank you. Moving on to item point 2, Macassa Lodge Redevelopment Project Financing Plan, Report HSC 20050 for Ward 7. Moved by Councillor Paul, seconded by Councillor Jackson to put the report on the floor. Any discussion on items 10.2? Did Councillor Pauls wish to speak to the report? Oh, we had you for a second there, Councillor. Try that again. We can't hear you, so you'll have to unmute yourself, Councillor Pauls. And then we're on 10.2.
You hear me?
Yes, we can. Go ahead. The floor is yours.
Thank you very much. I hope you can hear me clearly. I just want to say that we can all agree that the COVID has reinforced our need to make sure our most vulnerable senior in our nursing home are taken care of and have the best possible facility. And that's why we need to upgrade and improve 64 bed, and it is so crucial. But so when it's appropriate time, I would like to move the report, and I'm sure Councillor Jackson, who was a councillor for many years, and it was in his ward, will second it for sure. Thank you.
Thank you, Councillor Pauls. Any other councillors wishing to speak on the report? Seeing none. Oh, yes, he will. Councillor Jackson, go ahead. My apologies. I do see the speakers list now. Go ahead.
Not at all. Thank you, Chair Nan. And Councillor Pauls, thank you very much for your leadership on this in moving the report and the wonderful representation you've provided to the Lodge in the last 2.5 years in your first term on council. Chair Nan, I just think quickly it's important for the community to understand we could have all the debates in the world on the LRTs and other massive projects like that. But I would say sincerely and humbly, when it comes to looking after our frail elderly and our long-term care homes and retirement homes, and what we have learned during this horrible pandemic, for me, top priority is to ensure the highest standard of facility and care for the frail elderly residents that call the long-term care homes their place of residence at this time. So I'm strongly supportive of this. This is the old D wing that's over 30 years old since the last renovation's been done to it. Other wings have had renovations over the years done, but the D wing has been 30 years. So through you to whoever's here on staff, because I think it's important, I'm going to make, because I need to make a statement and a comment here in terms of funding. Whoever may be here on staff, if it's Senior Administrator Holly O'Diarty, the capital cost to demolish the existing old D wing and rebuild a B wing is about $27.8 million. Correct, Chair Nan, through you?
Through the chair, Holly O'Doherty, Senior Administrator, Councillor Jackson, that is correct.
And currently, the level of provincial funding, Holly, that we are aware of from the Ministry of Long-Term Care, is it about $1 million, a little more than $1 million? What do we have currently that we're aware of from the province? Through you, Chair Nan? I believe on page 5 of the report is what I was referencing, Holly.
Through the chair to Councillor Jackson, there will be approximately 6.7 million coming in from the province, from the Ministry of Long-Term Care over the course of the 25 years.
Okay, 6.7 million. I saw the 1 million reference here in terms of a development grant from the province, but overall you're saying it's close to 7 million. So, Chair Nan, the point oh, by the way, Holly, you currently have 44 of these antiquated dated beds in D-Wing. You're hoping, if all funding comes through locally and provincially, you're hoping to build a new B wing to have what, more than 44 beds through you, Chair Nan?
Through the chair to Councillor Jackson, there would be 44 beds moving from D wing to the new B wing with an additional increase of 20 beds that would support our wait list in the community.
So 64 beds, 20 of which would be new. And the conundrum, Holly, currently is that the province, so far from what we've heard, funding only less than 7 million. They're funding, if you will, the 20 additional new beds only. Through you, Chair Nan?
Through the chair, that's correct. The funding from the ministry would only be for the 20 enhanced beds.
So thank you, Senior Administrator Odiarty. Chair Nan, I'm not going to let go of this. I know Councillor Pauls is the lead as the new ward councillor for Macassa Lodge, hoping for committee support today for this report. Overall, 27.8 million needed to build a brand new B wing to accommodate the old 44 beds currently in D wing and add 20 more to accommodate the wait list in our community. I'm telling you, in the past, the province, the last major renovation we had in our city was Wentworth Lodge in Dundas about 12 years ago. If memory serves me right, around 07, 08. It was about a $20 million reno. The province gave us 50% reimbursement at that time. Here we are sitting at less than 7 million towards a nearly $28 million project. That's less than a quarter. I am going to, with Councillor Pauls, hopefully be imploring upon the province, the ministries, that please, if they're serious about what's come through on the Long-Term Care Commission report and the dire straits and the much better standard of care capital-wise, facility-wise, and human resource-wise in our long-term care homes need to be provided. I am going to hold Premier Ford and the province to their commitment to provide hopefully a greater amount of just what seems to be about a 25% level of funding, and hopefully even get it back to the 50% that they traditionally provided over the years. Thank you, Chair Nan. I get very passionate about this topic. Thanks for allowing my comments. And again, I'll second Councillor Pauls' motion on the report. Thank you.
Thank you very much, and thank you both for your leadership and advocacy and support for this. Absolutely, public care facilities like this one coming up to standard and high quality standard is supported by this committee. So it is before committee, duly moved and seconded, up for a vote. Councillor Pauls is a thumbs up, myself thumbs up, and Councillor Marula and Jackson, if you can indicate through eScribe. Oh, Councillor Pauls, you're still, if you could mute your microphone. Thank you.
And the vote is closed and it carries unanimous.
Wonderful. Thank you so much. Moving on to item 12, notice of motion. Any notices, committee members? Seeing none, general information and other business. Item 13, any items of general business or other business, general information? Seeing none, we'll then move to item 14, which is private and confidential. Members of committee, do you wish to move into closed session to discuss item 14.1, which is the general manager's office staffing change report? Okay, if not, then may I please have a mover and seconder to approve the following recommendations in item 14.1A, that the directions provided to staff in the closed session report respecting report HSC 21024, General Manager's Office Staffing Change, be approved, and B, that this report respecting General Manager Office Staffing Change remain confidential. Moved by Councillor Jackson, seconded by Councillor Pauls. Thank you very much. And Councillor Pauls is thumbs up. Before you electronically, I'm also in favor.
And the vote has closed. And it carries unanimously.
So much. And so we're on item 15. Who wants to move and second adjournment? With many thanks to our moved by Councillor Paul, seconded by Councillor Marula. Thanks to our guests presenters, all staff who were here in attendance to support today's meeting, and to the public who have watched online. We have adjournment.
We have a closed vote and unanimous.
All right, take care, everybody. Enjoy this
Thank you,
wonderful
Counselor.
Thursday
Thank
afternoon.
you for
Chair Nan,
understanding.
small contingent but productive.
All right, there you go.
Thank you.
Thank
Take care,
you.
everyone.